Now, with a report on joint replacement, here's our reporter, Laura Windsor.
Roger, joint replacement surgery to relieve the pain of arthritis is quite common in the United States. Odds are you know someone who has had this type of surgery. We talk with Dr. Edward Humbert of Lee Memorial Health System about the benefits of joint replacement surgery.
In humans in the United States right now, the most commonly replaced joint is the knee, followed closely by the hip and then the shoulder, and then smaller joints such as the elbow or the wrist or ankle. Wear and tear just wears off the articular cartilage, which is a smooth, frictionless surface on the end of the joints, whether it's the knee or the hip or the shoulder. As that surface wears off, the bone underneath that smooth, frictionless surface is exposed, and that rubbing bone on bone is very painful, and that's what you would have to resurface or replace to improve symptoms of pain.
Is surgery always the best option?
Obviously, you would try to do simple conservative routes prior to doing a surgery. Simple things such as anti-inflammatory medications. We can do injections of the joints with anti-inflammatory medications, which are very helpful in alleviating the short-term pain and give a short-term relief of discomfort from arthritis. People that fail that conservative care, where you try simple anti-inflammatory pills and injections, then end up needing surgery once they've failed the conservative care. If you're having some aches and pains and can take some Motrin or ibuprofen and get rid of those symptoms on your own over a 2 to 3 week period, those generally will get better by themselves. Someone that has a chronic, more persistent pain in the knee where you have consistent swelling or stiffness or limited activities where they're unable to do their daily activities that they used to do, that's someone who we need to evaluate and do an examination of their hip or their knee and can get x-rays of the hip and knee to evaluate the joint to determine the severity of the arthritis.
Dr. Humbert discusses the conservative treatments.
You know, more of a conservative surgical intervention for a knee or a hip could be arthroscopy, where you're not actually replacing the joint, but you're making that joint the best it can be with that person's knee or hip. You know, you can improve symptoms from meniscus tears, which are small little rubber tires in the joint that can have small tears. Those are very well treated with arthroscopy, which you can remove the tear and relieve pain. Arthritis generally is not treated with arthroscopy. It really does not respond very well, but as a conservative thing early and someone does not want to proceed with a big replacement, that's something that they can try early in the early disease process to help their symptoms without replacing the joint.
If the other options are not successful, what can we expect from a replacement surgery?
Complete knee replacement is by far the most common, most successful surgery for an arthritic knee. It actually fixes the problem of arthritis. All we're really doing when you resurface or replace the knee, which is just removing the damaged cartilage and bone from the end of the femur bone, which is one of the portions we replace, and we take a few millimeters of that damaged cartilage and bone and basically resurface the end of the bone. So now you have a nice smooth part to walk on. The other part of the knee replacement is the tibia. So now that surface is a nice smooth frictionless surface that you can now do everything you used to do without the pain you used to have. The techniques that we're able to use today are more minimally invasive and more patient-friendly, where they're actually able to get up and ambulate and walk much more quickly than they were 10 or 15 years ago. We used to keep patients in the hospital for 2 or 3 weeks. Now it's 1 or 2 days, and they're up and walking without their canes and walker, usually within 2 to 4 weeks.
For people suffering with disabling pain from arthritic joints, these surgeries can dramatically improve their quality of life. For the American Health Journal, I'm Laura Windsor.